The issue of reinfection depends on two things. The first is whether or not they have developed sufficient antibodies to the virus, and this is a very controversial area because we may have the antibodies, but they may not be necessarily protective. So even though traditionally we've said if someone's producing antibodies to a virus, they are therefore immune, we're so early into this outbreak that we don't know how much protection the patients having the antibodies are from future infections. There's recent unpublished data, it's for preprints, which seems to suggest that a third of patients who have had clinical COVID-19 have not developed antibodies. This is quite important because this means that are these patients still potentially infectious, or can they still potentially get the infection a second time? It's not ethical to do that, but what I think it indicates is that there are some patients who have very mild infection in which their body hasn't developed an immune reaction to this. The reason behind this is that the studies which we've found is that this virus, when it replicates, it may replicate only within some of the surface cells of the respiratory tract, and it may not be severe enough to actually allow the body to develop an immune reaction to it. So this is a very fast developing area. The other area which is now of very much interest is that people are now using the presence of these antibodies to see whether or not the patient has a virus. And there have been a number of tests, what have been called the finger prick tests, which have been used mainly in Northern Europe to try and detect people to see if they've got the virus. But just in the past few days, is that these tests have been found to be not very accurate, is that they're missing quite a few patients who've got active viral infection, but because they haven't developed the antibodies, the test will give a negative result. So I think it's important that from a management point of view and also from a screening point of view, is that it's best to go with the existing polymerase chain reaction PCR test rather than trying to look for these antibodies.